going into the study, we were under the impression that by doing a drainage procedure, either a ureteral stent or a nephrostomy tube, that provided sufficient treatment so that the treatment of the actual stone wasn't affected in any way, and that the timing of the definitive treatment was not necessarily an issue. However, once we did see the data, I think it gave us somewhat pause and made us reflect and say, well, it does matter, and just because you put a drain in doesn't necessarily mean you're protected over a long period of time. You actually sometimes need to intervene sooner, as long as that it's safe.
I think certainly it's going to give people a lot of pause for thought about how patients with stones are being managed. Are there ways to do things more efficiently? What do we have to do? This study focused on patients who are in a county setting. The different insurance issues, but this isn't an area that's going to impact patients regardless of what type of insurance they have, whether it's managed care, PPO, HMO, Medicaid, or the self-pay. We just need to be able to treat these patients quicker. It means that we need to have access to more resources, more operating room time, more trained staff in the operating room, perhaps more physicians as well.
I think it's a concern people have always had, but I think with the rising prevalence of stone disease over time, it's a more pressing issue now than ever before. The data shows that about 1 in 11 U.S. adults will have stone at some point in their lifetime. If that stone is involved with an infection in any kind of way, that becomes an emergent issue. And so I think, going forward, it's something that we really have to focus on to make sure the patients get the most timely care that they possibly can.
I think the most important message here is that patients who require a procedure for the stone, whether it be a stent or nephrostomy tube, that physicians need to expedite their definitive care. The longer these tubes stay in, the more likely the patient is to present with complaints to the emergency room, to the clinic. They may need more testing, and this will drive up the overall cost of an individual's health care.
It's important that when you're going over the clinical situation, kind of regardless of the patient's status, you kind of focus on how can we treat this patient in a timely fashion and in a safe fashion, and realizing that if there are delays, that can add to the morbidity to the patient and can really add to the cost of the overall care for stones, and that we should consider that in the global perspective when we're caring for all of our stone patients, whether they come in electively to our office from a referral or from the emergency department or from any setting, that we should really treat them in a timely fashion.